The baby is here. Everyone is happy. Everyone is celebrating. The messages are coming in. The visitors are arriving. People are passing the baby around, taking pictures, saying how beautiful the child is, how blessed the family is, how good God is. And in the middle of all of that, the mother is sitting somewhere, exhausted, in pain, bleeding. Her body feels like it has been through a war because it has, her hormones are crashing. She has not slept properly in days. She's trying to figure out how to feed a baby that depends completely on her. She does not feel like herself. She does not know when she will feel like herself again. And she's smiling for the pictures because that is what is expected of her. And nobody, not one person in that room has asked how she's doing. Not how is the baby. Not is the baby feeding well. Not is the baby sleeping. But how she is. How is her body? How is her mind? How is she coping? What does she need? The question, how is the mother, is one of the most neglected questions in maternal health. And in the silence around it is not just unkind, it is medically dangerous because the weeks and months after birth, what the medical world calls the fourth trimester, are some of the most physically demanding and emotionally vulnerable weeks in a woman's entire life. And most women go through them with almost no preparation, very little support, and a lot of pressure to bounce back, look good, and act like they are fine. Today, we're going to talk about everything that nobody told you about the fourth trimester. What happens to a woman's body after birth, what she needs, what the warning signs are, what is normal and what is not, what she can eat, what she should avoid, how to recover properly, not just survive the early weeks, and what all of us partners, families, friends, communities can do to actually support a woman who has just given birth. This is a section I wish every pregnant woman could see before she delivers, and it is the section I wish every family member, every partner, every mother-in-law, every friend could see, so they understand what the woman's they love is going on, what the woman they love is going through, and what she actually needs from them. Welcome, welcome, welcome. Happy Thursday, and I am so glad you're here. I wanted to drop a hello in the comments right now, telling me where you are watching from, and tell me this, if you've given birth before, did anyone properly prepare you for what the first few months after birth would feel like? I wanted to type yes if you were prepared, or no if you felt completely blindsided, because I have a very strong feeling about what these comments are going to look like. My name is Loretta Ingwebe Sebiel, and this is the Safe Delivery Project, part of Do Take Action family. Every Thursday at 3 p.m., we show up and have honest, important conversations about health. And today is one of the most important sections we have had on this platform. One full hour, no guests, just the truth about what happens after the baby arrives. So I wanted to get comfortable, get your water, and let us go. So I'm going to start by explaining what the fourth trimester actually means, because it is a term that most people have never heard, and yet it describes one of the most significant periods in a woman's life. Pregnancy is divided into three trimesters. The first trimester is week 1 to 12. The second trimester is weeks 13 to 26. The third trimester is weeks 27 to 40. And after the baby is born, after the third trimester, no, after the third trimester ends, most people assume the journey is over. pregnancy is done, the baby is here. Now we focus on the baby. But that assumption leaves out something critical. The mother's body does not simply return to its pre-pregnancy state the moment the baby is born. Her body has spent 9 months growing, stretching, adapting, changing in profound ways to support and carry a new life. And after birth, it needs time to recover, heal, and readjust. That recovery period, roughly the first 12 weeks after birth, is what pediatrician and author Dr. Harvey Karp first called the fourth trimester. And the name has stuck because it captures something important. The period after birth, is not a postscript to the pregnancy. It is a stage in its own right, and it deserves the same attention, the same care, and the same support as the three trimesters before it. Now, here's what is happening in a woman's body in these first 12 weeks after birth. Her uterus, which grew from the size of a pear to the size of a watermelon over 9 months, is now contracting back to its original size. Her hormones, which were at extraordinary levels during pregnancy, crash dramatically, after delivery, particularly estrogen and progesterone. Her body is healing from the physical trauma of birth, whether that is prenatal tears from a vaginal delivery, episiotomy wounds, or a surgical incision from a C-section. Her blood volume, which increased by approximately 50% during pregnancy, is returning to normal. Her pelvic floor, the group of muscles that support the bladder, uterus, and bowel, has been under enormous strain and is recovering. And if she's breastfeeding, her body is simultaneously doing all of this while also producing milk, which requires significant energy and nutritional resources. Now, all of this is happening at the same time that she's caring for a newborn who needs to be fed every 2 to 3 hours, who does not sleep in long stretches, who cries and needs attention around the clock. Of all this while she's sleeping, deprived. All of this while her hormones are crashing. All of this while receiving a stream of visitors who mean well but are adding to her exhaustion. Now, the fourth trimester is not a rest period. It is a profound physical and emotional challenge, and it deserves to be treated as one. But the key fact is that the World Health Organization recommends that all women receive postnatal care from a skilled health worker within 24 hours of birth, and at least three additional postnatal checkups at 3 days, between 7 and 14 days, and at 6 weeks after birth. In Nigeria, postnatal care is significantly underutilized, and many women attend no formal postnatal checkup at all after leaving the hospital. Now, to my audience, if you have given birth, how many postnatal checkups did you attend after leaving the hospital? I want you to type the number in the comment. Is it 0, 1, 2, 3 or more? And I want you to be honest. Okay, now I'm going to walk you through what is physically happening in a woman's body in the weeks after birth, because I think when you understand biology, when you understand what the body is actually going through, you understand why rest, nutrition, and support are not optional extras. They are medical necessities. Now I'm going to talk about the uterus. Um, After delivery, the uterus immediately begins a process called involution, contracting back to its pre-pregnancy size. This takes approximately 6 weeks, and the contractions that happen as the uterus shrinks can be felt as after pains, cramp like pains in the lower abdomen that can be surprisingly strong, particularly in women who have given birth before. Now, these after pains are normal and are actually a sign that the uterus is contracting properly. So they learn to be stronger during breastfeeding because the baby sucking triggers the release of oxytocin, and so that the hormone that causes uterine, contractions. Paracetamol can help manage the pain, but if the pain is severe, accompanied by heavy bleeding or fever, please it's advisable to always seek medical attention. And secondly, I'm going to talk about lucia, which is the post-birth bleeding. The post-birth bleeding. Now, after birth, whether vaginal or C-section, a woman experiences vaginal bleeding called lucia. This is the shedding of the uterine lining and any remaining pregnancy tissue. So it is completely normal and expected. But understanding what is normal is important because abnormal bleeding can indicate a serious problem. So in the first few days, lucia is bright red and may contain small clots. This is called lucia rubra from about day 4 to day 10. Now, the bleeding becomes pinkish or brownish and lighter, and so this is called lucia serosa. From about day 10 onwards, the discharge becomes white or yellow and eventually stops completely, usually by 4 to 6 weeks after birth. Why is not normal and needs immediate medical at ten tion? Soaking through a thick pad in an hour or less, passing clothes larger than a plum, lucia goes back to bright red heavy bleeding after it has started to reduce, and foul smelling lucia which can indicate infection. So any of these signs are reasons to go to hospitals urgently. And thirdly, I'm going to talking about the healing from birth wounds. If a woman had a vaginal delivery, she may have perineal tears or an epistomy. Now, an epistomy is a surgical cut made in the perineum, the area between the vaginal opening and the anus, to enlarge the opening for delivery. So both tears and epistomies need to heal and require care. So keeping the area clean and dry is essential. Rinsing with clean warm water after using the toilet. Patting dry rather than wiping, changing pads regularly, sitting on a cushion or donut pillow to reduce pressure, salt baths, sitting in a shallow bath of warm water with a small amount of salt can help with healing and comfort. So, and signs of infection in the wound include increasing pain, swelling, redness, warmth or discharge from the wound, and dis need prompt medical at ten tion. And so if a woman had a C-section, a wound is a surgical incision through multiple layers of tissue, skin, fat and uterus. So this one needs weeks to heal properly, and keeping it clean and dry. For that you have to keep it neat and dry and avoid any pressure on the wound, and do not lift anything heavier than the baby. Watch for signs of wound infection, redness, swelling, warm discharge, opening of the wound or fever, because C-section wounds also require emotional adjustment, and some women feel grief or disappointment about having had a surgical birth, and this is completely valid and deserves to be acknowledged. And also I'm going to talk about the pelvic floor. The pelvic floor is a group of muscles and connective tissue that form a hammock-like structure at the base of the pelvis. Now, these muscles support the bladder, the uterus, and the bowel. During pregnancy, they carry the weight of the growing baby and uterus, and during vaginal delivery, they stretch enormously to allow the baby to pass through. Now, after birth, the pelvic floor is weakened and needs to recover. And so The signs of pelvic floor weakness include leaking urine when you sneeze, cough, laugh or exercise. This is called stress incontinence. Feeling like an urgent need to urine that is difficult to control, a feeling of heaviness or pressure in the vagina, which can indicate pelvic organ prolapse, and where one or more of the pelvic organs drums into or out of the vaginal canal. And so the pelvic floor exercise, also called the Kegel exercise, are the single most important thing a woman can do to support pelvic floor recovery. They involve contracting and releasing the pelvic floor muscles, and the same muscle you would use to stop urine flow. So this exercise can and should begin within the first few days after birth. These are safe, free, and highly effective, and they should continue for months after birth, not just a few weeks. And I'm also going to talk about the hormonal crash. This is perhaps the most dramatic and least discussed physical change of the fourth trimester, because during pregnancy, estrogen and progesterone, that is the key female hormones, are at the highest levels they will ever be in woman's life, because they are what maintain the pregnancy. And the moment the placenta is delivered, they plummet dramatically rapidly within 24 to 48 hours of delivery. Estrogen and progesterone levels drops to the lowest they will, they'll be since before puberty. And so this hormone crash is what drives the baby blues, the weeping, the emotional vulnerability, the feeling of being overwhelmed that most women experience in the first week after birth. It affects mood, energy, sleep quality, and emotional regulation. So it is entirely normal, but it is also completely underestimated in its impact and almost never properly explained to new mothers. And so understanding that the weeping in week one is hormonal, and that is a psychological response to a massive hormonal change, not a sign that something is wrong, not a sign that you are a bad mother, not a sign that you cannot cope. It's important, and it helps women and their families respond with compassion rather than alarm or dismissal. So I'm going to be asking my audience, did anyone tell you before you gave birth about the hormonal crash and the baby blues, where you warned that you might cry a lot in the first week, even if everything was fine? I want you to type yes or no in the comments section right now. So now I want to spend real time on something that is one of the most serious and most under discussed postpartum health issues, and that is postpartum depression. Let me first separate two things that often get confused. The baby blues and postpartum depression are not the same thing. The baby blues and postpartum depression are not the same thing. The baby blues are what most women experience in the first week or two after birth. Weeping for no obvious reason, feeling overwhelmed and emotionally fragile, mood swings, anxiety. These symptoms typically begin around day 2 or 3 after birth, and when the hormone crash is most pronounced, and usually resolve on their own by 2 weeks. So the baby blues are normal. They are experienced by approximately 70 to 80% of new mothers, and they do not require treatment. They require rest, support, reassurance, and time. Now, postpartum depression is different. It is a clinical mood disorder, a real medical condition that affects approximately 1 in 5 new mothers. It can develop anytime in the first year after birth, though it's most commonly it most commonly begins between 2 and 8 weeks after delivery. And unlike the baby blues, it does not resolve on its own without support and often without treatment. So what does I'm going to talk about what postpartum depression look like, and I'm going to describe it honestly because I want every woman watching and every family member of a new mother to be able to recognize it, because persistent sadness and not just feeling sad some days, but a sadness that is there most of the time and does not lift, a kind of flatness or emptiness that takes the joy out of things that should feel joyful, including the baby. So, feeling like a failure as a mother, intense guilt, feeling like you are not good enough for your baby, feeling like your baby would be better off without you, feeling like you are doing everything wrong. These thoughts, having these thoughts in your mind, particularly when they are persistent and overwhelming, these are symptoms of postpartum depression, not reflections of the truth. Now, difficulty bonding with the baby. This is one that women rarely talk about because of the enormous guilt and shame attached to it. But some women with postpartum depression find it difficult to feel the rush of love for their baby that everyone told them to expect. They care for the baby, mechanically feeding, changing, soothing, but feel disconnected and numb. And this is a symptom. It is not a reflection of your love for your child. And it gets better with treatment. And so severe anxiety, constant, overwhelming worrying about the baby's health and safety, intrusive thoughts about something terrible happening to the baby, being unable to sleep even when the baby is sleeping because of anxiety and panic, panic attacks. And so also loss of appetite or overreacting, significant changes in eating, not wanting to eat or using food to cope, inability to function, finding it impossible to manage basic daily tasks, not getting dressed, not being able to look after the home, feeling paralyzed by the demands of daily life. And in the most severe cases, thought of harming oneself or the baby. These thoughts are a medical emergency. And if a woman who is experiencing thoughts of harming herself or her baby, she needs immediate psychiatric care. This is not something to manage at home. It is not something to pray through alone. It is a medical emergency. And and so I want to say something about postpartum depression in the Nigeria context, specifically because there are additional layers here. Because in many Nigeria families and communities, a new mother who is struggling, is told to be grateful. She has a healthy baby. She should be happy. Crying all the time is a sign of ingratitude. Depression is not real. It is a sign of weak faith or spiritual attack. She should pray more. You see when saying you pray more. Um, um, she should be stronger, and so women suffer in silence. If you're saying all these things, and it makes women to suffer in silence, and they do not tell their parents, they do not tell their mothers, they do not seek help because the culture around them has not given them permission to be anything other than being happy. And the depression deepens and the days become harder, and some of these women do things in this dark moment that cannot be undone. And so the conversation around postpartum depression in Nigeria needs to change, not gradually or urgently, but it really needs to change. And so the key fact is that postpartum depression is treatable with the right support, counseling, therapy, medication where necessary, and community support. Most women with postpartum depression recover fully And early recognition and early intervention, lead to the best outcomes, and suffering in silence lead to the worst ones. And so now, what can family members do? What can they do? It's available to check on the mother, not just the baby. Always check up on the mother, ask how she's feeling. Um, take the baby for a few hours so she can sleep. Listen without judgment. Do not tell her to be grateful or to snap out of it. If she tells you she's not coping, believe her. Help her access professional support. So these are the things that every family member needs to do. Now, I'm going to talk about what to eat after birth. Feeding your recovery. So I'm going to talk something very practical and very important. What should a woman eat in the weeks and months after birth to support her recovery? This is a topic that is surrounded by a lot of tradition, a lot of cultural beliefs, a lot of well-meaning advice that is not always evidence-based. And some of these traditional practices are genuinely beneficial, some are neutral, and some can actually be harmful. And I want to help you tell the difference. First, I'm going to explain what the body needs nutritionally in the fourth trimester and why. Okay. A woman who has just given birth has been through an enormous physical event. Her body has lost blood, her tissues are healing, her hormones are resetting, And if she's breastfeeding, her body is producing milk, which requires approximately 300 to 500 extra calories calories per day above her normal needs. And all of this means that her nutritional needs in the weeks after birth are actually higher than they were even during pregnancy. And so she needs more of almost everything: more energy, more protein, more iron, more calcium, more fluids. And yet, this is often the time when women eat poorly because they are too tired to cook, because they are prioritizing feeding the baby over feeding themselves, because well-meaning family members are focused on the baby and not on ensuring the mothers eat well. So um I'm going to list out what she needs, what a breastfeeding mother needs. We have the iron rich foods. Birth involves blood loss, and blood loss depletes iron, and low iron leads to anemia, which causes exhaustion, weakness, poor immune function, and impaired recovery. Iron rich foods will include and also iron rich food includes liver, red meat, chicken, fish, beans and lentils, dark leafy vegetables like ugu and water leaf, and eggs. And so eating these foods alongside vitamin C rich foods, tomatoes, oranges, peppers significantly improves iron absorption. And protein is what the body uses to prepare tissue and heal wounds. And every meal should contain a source of protein: eggs, fish, chicken, beans, groundnuts, dairy. A woman who is healing from a C-section incision or prenatal tears especially needs adequate protein to support wound healing. And also we have calcium. Breastfeeding draws calcium from the mother's body to produce milk. And if her diet does not provide enough calcium, the body takes it from her bones, which over time can reduce bone density. So, calcium rich foods include dairy products like milk, yogurt, cheese, as well as small fish eaten with bones, dark green leafy vegetables, and fortified fruits. And we also talk of fluids. A breastfeeding woman needs significantly more fluid than usual because breast milk is approximately 30% water. Dehydration reduces milk supply, causes fatigue, and impairs recovery. And so, she should be drinking at least 2 to 3 liters of fluid per day. Water, soups, pap, herbal teas, caffeinated drinks should be moderated because caffeine passes into breast milk. And I'm going to talk about fibrin. Constipation is extremely common after birth and caused by hormone changes. It reduces physical activities, dehydration, pain medication, and fear of straining near the wound or stitches. And eating plenty of fiber-rich foods like vegetables, fruits, whole grains, beans helps prevent constipation. And so drinking plenty of water is also equally important. And I'm going to talk about the healthy fats. Omega-3 fatty acids are important for brain health, including the baby's brain development through breast milk. And for managing postpartum mood, good sources include fish like mackerel and sardines, walnuts, flaxseed, and palm oil in moderate amounts. So, going to talk about some traditional practices, like the pepper soup. This is widely given to women after giving birth in many Nigeria cultures. And there's actually a good reason for it because a well made pepper soup with catfish or assorted meat is high in protein, has warming properties that may help the uterus contract, and is easy to digest. It also provides fluid, and this is a genuinely beneficial postpartum food, provided it is made clearly with fresh ingredients. We have the ogi or pap, which everybody knows as akamu. Fermented maize porridge is usually digestible and gentle on the stomach in the early postpartum period, because it provides carbohydrates for energy, and adding milk, groundnut or egg makes it more nutritionally complete. And how about the bitter leaf soup like egusi, bitter leaf soup, egusi soup, oha soup, ogbono soup? These traditional soups made with dark leafy vegetables and protein rich ingredients are excellent postpartum food because they provide iron, calcium, protein and vitamins, and so you need to continue eating all of this. And what to moderate or avoid: very heavily salted foods. You need to avoid salty foods, because salt causes fluid retention, which can worsen postpartum swelling. Cold foods and drinks are avoided in many cultures after birth. And why there is a limited scientific evidence for harm, there's also no strong evidence against the practice. And if avoiding cold drinks encourages a woman to drink more warm fluids, it is beneficial. And also alcohol should be avoided entirely while breastfeeding, as it passes into the breast milk. Highly processed and junk foods, this provide little nutritional value at a time, and when the body needs maximum nutrition. And so it's always advisable to avoid alcoholic food when breastfeed sorry alcoholic drink when breastfeeding. Now what about the belly? Yes, because I know many of you have been waiting for this part. What about the belly after birth? What can a woman do to help her belly return to shape? Let me completely be I want to be completely, honest with you, because the belly after birth is a medical topic, not just an aesthetic one. During pregnancy, the abnormal muscles, particularly the two large muscles running down the center of the abdomen, separate to accommodate the growing uterus, and this separation is called diastasis recti after birth. These muscles need time and the right exercise to come back together. What helps? We have walking, starting gently as soon as you feel able, even short walks gradually increasing over weeks. You can start shortly, and then over weeks, you increase it. So pelvic floor exercises, core exercises specifically recommended for postpartum recovery, which are different from regular abdominal exercises. Gentle breathing exercises that engage the deep core muscles. And what can harm? Sit-ups and crutches in the early postpartum period, particularly if there is a diataxis recti, can actually worsen the muscle separation. Aggressive exercise too soon after birth, particularly after a C-section, can damage healing tissue. Tight belly bending immediately Tight belly binding immediately after birth, a common practice in many Nigerian cultures, has limited scientific evidence for benefits and can potentially increase pressure on the pelvic floor if done incorrectly. And so the honest truth about the postpartum belly is this: it took 9 months to grow. Give it at least 9 months to recover. The pressure on woman to have a flat stomach weeks after birth is culturally driven and is not medically realistic or fair. So your body grew as a human being, and so it deserves grace, time and proper nourishment, not punishment. So the key fact about this is that research shows that women who receive adequate nutrition and rest in the first 6 weeks after birth have significantly better physical recovery outcomes, including faster wound healing, better breastfeeding success, and lower rate of postpartum complications. Okay, so now let's talk about breastfeeding, and I want to talk about it honestly because the way breastfeeding is presented to most women does not prepare them for the reality, and that gap between expectation and reality causes enormous distress. The message most women receive about breastfeeding is something like this: breast is best, it is natural, it is instinctive, your baby will know what to do, your body will know what to do. Just put the baby to the breast and it will happen. And for some women that is true, but for many women, possibly most women, breastfeeding is one of the hardest things they have ever done, and nobody want them. Breastfeeding is a skill, not an instinct. It has to be learned by the mother and by the baby. And learning, it takes time, patience, and support. And in early days, it can be painful. Nipples crack and bleed, the way the baby attaches to the breast. It takes practice to get right. So, milk supply does not always establish easily. The baby may lose weight in the first few days before the milk comes in, which is normal but frightening if nobody has explained it. And the mother is doing all of this while recovery from birth, sleep deprived, and um, hormonally crashing. Now, I'm going to tell you what is normal in early breastfeeding that nobody warns women about, because in the first 2 to 3 days, in the first 2 to 3 days, the breast produce not milk but colostrum, a thick yellowish fluid that is sometimes called liquid gold. And colostrum is produced in very small amounts, measured in milliliters, not ounces. And so many new mothers panic because they cannot see the milk and assume they have nothing. But colostrum is exactly what a newborn stomach needs. It is concentrated, it is rich in antibodies, and the newborn stomach is tiny, about the size of a marble at birth. And so the small amount of colostrum is perfectly designed for it. Around day 3 to 5, the milk comes in, and when it does, the breast can become very full, hard, and uncomfortable. This is called engorgement, and it is normal. And so, feeding the baby frequently every 2 to 3 hours is the most effective way to manage engorgement and establish a good milk supply. Now, nipple pain in the early weeks is common, but severe pain, cracked nipples, bleeding nipples, or pain that does not improve after the first 2 weeks is a sign that the latch needs to be corrected. A lactation consultant or experienced midwife can help correct the latch and transform the breastfeeding experience. And so, please, if you're feeling this, I want you to please seek help. Do not suffer through pain for weeks because nobody told you that help exists. So, I'm going talking about the mastitis, inflammation of the breast tissue. It is a common breastfeeding complication. It causes breast pain, redness, warmth, and hardness in the breast, often accompanied by fever and flu-like symptoms. It happens when milk builds up in the breast, often from a blocked duct, and becomes infected. Mastitis needs antibiotic treatment, so do not try to manage it at home alone. Continue breastfeeding through mastitis. Stopping feeding actually makes it worse. So if you're experiencing this, please see a doctor. And for women who are unable to breastfeed for whatever reason, I want to say this clearly: fed is best. A formula fed baby who is nourished and loved is doing well. Breastfeeding is beneficial and worth every effort to establish, but it is not worth your mental health. It is not worth months of agony. And a mother who is suffering through feeding is not serving her baby. So please seek support, and if after genuine effort breastfeeding is not working, please do not carry guilt about that. And so the World Health Organization recommends exclusive breastfeeding for the first 6 months of a baby's life, followed by continued breastfeeding with appropriate complementary foods up to 2 years and beyond. Breast milk provides antibodies that protect the baby from infection and disease, and the benefits are well documented. But supporting breastfeeding requires supporting the mother with lactation support, adequate nutrition, rest, and freedom from judgment. And so, to my audience, for those who have breastfed, was it easy or difficult? And did you have enough support? Type easy, hard, or hard but worth it in the comments. Okay. I also want to talk about something that gets very little space in maternal health conversations. What happens to a relationship after a baby arrives? Because the changes in a relationship in the fourth trimester are significant. They are often shocking and they are almost never discussed openly before birth. Okay, the arrival of a baby is one of the greatest joy a couple can share, and it is also one of the greatest stressors a relationship can face. These two things are true at the same time, and pretending only the joy is there while the stress quietly builds is not good for the mother, the father, or the relationship. What changes after birth? Sleep deprivation, both parents are tired, but the mother, particularly if she's breastfeeding, is typically more sleep deprived because she is the primary feeding source at night. So sleep deprivation affects mood, patience, emotional regulation, and decision making. It makes small irritations feel enormous, and it makes communication harder. It makes connection feel impossible when you are both running on empty. And so the shift of attention before the baby, the couple's attention was primarily on each other, and after the baby all attention from both partners and from family and friends shifts completely to the child. And so the mother loses her identity as a woman and a partner. She becomes the mother or baby's mom. And so the partner may feel sidelined, the mother may feel unseen. So both may feel disconnected from the relationship they had before. And we have the physical changes and intimacy. The physical relationship between partners typically cannot resume until after 6 week postnatal check at the earliest. And for many women, it takes significantly longer, and the mother's body may feel foreign to her. She may have pain from her birth wounds. She may be touched out from breastfeeding, feeling that her body has given all the physical contacts, and it has to give and needing space. And so those changes are normal, but they need to be communicated, and the partner needs to understand and respect them without pressure. So the different approaches to parenting. Couples discover very quickly after birth that they sometimes have very different ideas about how to care for a baby, how to settle the baby, when to pick the baby up, how to respond to crying. So these differences can cause tension and argument at a time when both parents are already depleted. And for the mental load, I want to say this plainly because in most Nigeria households, the vast majority of the labor around the new baby, the feeding, the bathing, the settling, the night waking, the doctor appointments, the tracking of feeding and sleeping falls on the mother. Even when the partner is present and willing to help, the mental load, the remembering, the planning, the organizing is often carried by the mother. And this imbalance is exhausting and breeds resentment. And so it needs to be talked about and actively redistributed. What does a supportive partner look like in the fourth trimester? They do not wait to be asked. They notice what needs to be done and they do it. They take the baby to the mother, you know, can sleep, and they make sure she has eaten. They handle the visitors when she's exhausted. They'll tell her she's doing well when she doubts herself. They do not add to her emotional load, they help carry it. And for couples, talk to each other. Do not let the disconnection of the fourth trimester become a wall that hardens over months and years. Have the difficult conversations early. Say what you need. Ask what your partner needs. Get support if you need it. Couples counseling after birth is not a sign that the relationship is failing. It is a sign that you are both taking the relationship seriously enough to protect it, through one of its most challenging sections. And research consistently shows that relationship satisfaction drops significantly in the first year after having a baby. For both mothers and fathers, couples who communicate openly, share responsibilities, and maintain even small gestures of connection, you know, are significantly more likely to navigate the transition to parenthood successfully. So I'm going to talking now about the warning signs after birth that need urgent attention. So I'm going to spend more time on something that could directly, save a life, which is the postpartum warning signs that every woman and every family need to know. Because the most dangerous complications after birth do not always happen in the hospital. Many of them happen after a woman has gone home, after the medical supervision has ended, after she's back in her community surrounded by family who love her, may not even know what to watch for. Which so we're going to be talking about the postpartum hemorrhage, excessive bleeding, which is the leading direct cause of maternal death in Nigeria. We talked about normal postpartum bleeding earlier. So now here are the signs that the bleeding has become dangerous and needs emergency attention. So sucking through a thick maternity pad in an hour or less, passing blood clots larger than a plum, feeling dizzy, faint, or light-headed, which indicates significant blood loss. A rapid or weak pulse, pale, cold, clammy skin, loss of consciousness. These are signs of hemorrhage, and this is a medical emergency. So you're advisable to call for help immediately and get to the hospital without delay. And what are the signs of postpartum infection? Dispersion, sepsis. After birth, the uterus, the birth wounds, and the breast are all vulnerable to infection. And the signs of serious infection include fever above 38 degrees Celsius, chills and shaking, a foul smelling vaginal discharge, increasing pain in the abdomen or at the wound site, redness, warmth, or discharge from C-section wound or perineal wound, breast pain, redness and hardness with fever, indicating mastitis sepsis. Widespread infection in the blood is life-threatening and one of the leading cause of maternal deaths. You know, is actually one of the leading causes of maternal death, and it progresses rapidly. So do not wait. If a woman has fever after birth alongside any of the above signs, she needs emergency care. And so the signs of preeclampsia or eclampsia after birth, preeclampsia, high blood pressure with protein in the urine can actually develop for the first time after birth. But just during pregnancy, signs include severe headache, vision changes, blurring, seeing spots or flashy lights, upper abdominal pain, particularly under the right ribs, sudden severe swelling of the face and or feet, convulsions which indicates eclampsia. So these are emergency symptoms. So you need to get to the hospital immediately if you're experiencing any of these. And now, what are the signs of deep vein thrombosis and pulmonary embolism? After birth, the blood is in a hypercoagulable state, meaning it clots more easily than normal. This is a protective mechanism to reduce bleeding, but it also increases the risk of dangerous blood clots. A blood clot in a deep vein thrombosis typically causes pain, swelling, warmth, and redness in one leg. And if a blood clot travels to the lungs, pulmonary embolism, it causes sudden shortness of breath, chest pain, and rapid heart rate. This is a life-threatening emergency. So any sudden shortness of breath after birth needs immediate emergency evaluation. And so the signs of postpartum psychosis, this is rare, of course. This is rare, affecting approximately 1 to 2 in every 1,000 new mothers. But when it occurs, it is a psychiatric emergency. So postpartum psychosis involves a rapid onset of severe symptoms, hallucinations, delusions, extreme confusion, severely disorganized behavior, not sleeping for days, and in some cases, thought of harming the baby. So this requires immediate psychiatric hospitalization, and it is not managed at home. It is not prayed away. It is a medical emergency. And so most maternal deaths that occur after birth happen within the first 24 hours, but a significant proportion occur in the weeks after discharge from hospital. And so this means postnatal care and education about warning signs are critical for every woman who has given birth and every family supporting her. So please, every person watching today, learn these warning signs, write them down, share them with your family, because you may one day be the person who recognizes a warning sign in time to save a woman's life. So I want to end the teaching part of today's section by painting a picture of what good postpartum support actually looks like, because I think many people want to help a new mother but genuinely do not know how. They show up, they admire the baby, they give advice nobody asked for, and they leave, leaving the mother more exhausted than before they came. But good postpartum support is not about the baby, it is about the mother. When you visit a new mother, bring food, not just a small snack, a proper meal, something nutritious that she did not have to think about or prepare. And if you can, bring enough for several meals. Cooking is one of the things new mothers most struggle to do in the early weeks. A meal brought to her door is more valuable than almost anything else you can give. So when you visit, offer to take the baby, not let me hold the baby. While the mother stands beside you watching, take the baby and tell the mother to go and sleep, go and shower, go and sit by herself for 30 minutes. The most precious gift in the fourth trimester is uninterrupted time. Time to sleep, time to eat, to simply exist without someone needing something from you. So, when you visit, do not give unsolicited advice. Do not tell her she's feeling wrong. Do not tell her the baby should not be sleeping in the room with her. Do not tell her she needs to discipline the baby already. Do not tell her she does not look well. Ask her what she needs and then do that. And for family members who are present in the household, share the night duties. Not every night, but some nights. Let the father take a feeding. Let a grandmother settle the baby for a few hours so the mother can sleep a full sleep cycle. Sleep deprivation is one of the primary drivers of postpartum depression, and every additional hour of sleep a new mother gets is a genuine health intervention. And for partners, please be present, not just physically in the house but emotionally present. Notice when she's struggling, ask how she is, really ask how are you doing. Tell her she's doing well, tell her the baby is lucky to have her as a mother, because affirmation costs nothing and means everything to a woman who is doubting herself in the early weeks. And for the mother herself, please allow yourself to receive help. Nigerian women are often so conditioned to be self-sufficient. Do not burden others to insist that they are fine, but they push away the very support they need. You are allowed to say, I need help. You are allowed to say, I am not coping. You are allowed to hand the baby to someone you trust and go and lie down. Accepting help is not a weakness, it is wisdom. It is what allows you to recover properly. And a mother who has recovered properly is a better mother, a better partner, and a healthier human being. Okay, so we've been here for over an hour, and I want to say something before I let you go. You know, when a baby is born, two things are born: a baby and a mother. The baby gets all the attention, the mother gets asked about the baby. But the mother is also new, she's navigating a body she does not fully recognize. So emotions she was not fully prepared for, a relationship that has changed, a life that has transformed overnight. She's doing something enormous and she's doing it while everyone around her is focused on someone else. So today we focused on her. We talk about what is happening in her body, about the bleeding and the hormonal crash and the pelvic floor and the healing. We talk about what she needs to eat and why. We talked about the truth of breastfeeding, the difficulty and support it requires. We talk about postpartum depression and the warning signs that need emergency attention. We talked about our relationship and our mental health and what real support looks like. This information is not a luxury. It is not nice to know. It is life saving, because the fourth trimester is the period in which so many Nigeria's women are lost to hemorrhage, to infection, to preeclampsia, to depression, to complete physical and emotional depletion. And most of these losses are preventable. So if you're pregnant right now, please save this video. Watch it again as you get closer to your due date. Share it with your partner. your mother, your mother-in-law, your closest friend, because the people around you need this information as much as you do. So if you have already given birth, it is never too late to support your own recovery. Eat well, sleep when you can, seek help if you are struggling mentally, do your pelvic floor exercises, attend your postnatal appointments, take your health seriously because you brought life into the world, and so your life matters too. And if you're a partner, a family member, a friend, please take everything you heard today and use it, not to give advice, to give support, real, practical, ongoing support, because a well supported mother is a healthy mother, and a healthy mother is the foundation of a healthy family. So please like this video if today gave you something important, and leave a comment. Tell me one thing you learned today that you did not know before, or one thing you wish someone had told you after your birth. And also subscribe so you never miss a Thursday. And please share this video with every pregnant woman you know, with every new mother, with every partner and family member who want to do right by the woman they love. Because this is a section I wish existed when so many of us needed it. And sharing it means it gets to the person who needs it today. I'll see you next Thursday. Take care of yourself, and please take care of the mothers.